Hi, I'm Nurse Kristen, and I'm the Nurse Aide Training Manager at London Care Force Institute. Today, I'm going to be demonstrating how to properly don and doff PPE, and I wanted to start off with a review of the equipment that you're going to be using and the terminology for today. Now, starting off with terminology, PPE is the acronym that stands for Personal Protective Equipment. Donning means to put on, and doffing means to take off. Now, let's review the equipment. We're going to start off with donning. We're going to don our gown first, our mask, our goggles, our gloves, and of course our hand sanitizer is handy. I also recommend having a small trash can nearby so that you can easily dispose of all of your PPE when you're done with doffing. Now there is a special order for doffing as well. So the doffing procedure is going to start off with our gloves. So we're going to remove our gloves, then we'll remove our goggles, then we'll remove our gown, and then we'll remove our mask. And then we're always going to sanitize our hands when we're first starting with donning and then when we're ending with doffing. So keep that in mind, and next I'm going to demonstrate how to actually do it. Now, the first step for donning is to make sure that we sanitize our hands. So I'm going to take hand sanitizer because my hands are not visibly soiled, and make sure that I'm rubbing all surfaces until the hand sanitizer is completely dry. And I'm going to start off with my gown. So be aware that your gown has two strings, one around your neck and one around your waist. So just be careful not to contaminate them when you're putting on your gown. So I'm going to gently open up my gown and try to hold the gown by the neck piece, and then you can slide your hands into the armholes and turn around, and you're going to tie your strings around your neck first. So I always like to tie them in more of a bow so it's easy to untie later. Next, I'm going to try to make sure that my gown is overlapped. And I'm going to find the strings around my waist, again, making sure that they're not touching the floor if they are too long. And you're going to go ahead and tie around your waist, never bringing those strings to the front because that will increase contamination. Okay, once you have tied both of your neck and your waist, you can move on to the next step, which is making sure you put your mask on. So your mask has two different sides. The darker side generally is facing outward and the lighter side is facing inwards towards your body. You're going to find this space with the small metal rod that is going to help to form around your nose. So we're going to make sure that's facing upwards towards the ceiling, and you're going to put the ear loops just around your ears, and then you're going to form that metal rod around your nose to make sure that it's nice and form-fitting, and then pull down the chin area so it's covering your entire face. Next, we're going to put our goggles on. And lastly, you're going to put your gloves on. So I recommend making sure that you pull down the cuff of your gown so that you can take your glove and place it right over that cuff. You're going to take your glove and hold it with the opposite hand. And then you're going to again hold on to the cuff of the gown so that you can completely cover the cuff of your gown with the cuff of your glove. We don't want any exposure because that's an area where any type of bacteria can get through. Okay, so there's no open areas. Now I'm going to do the same thing. Just hold on to the cuff of my gown. And don't be afraid if you can't get the fingers completely lined up, because you can go ahead and fix that later. Okay, so now as you can see, I don't have any areas that are open or exposed between my gloves and my gown. Now I can go and do the procedure that I'm set out to do. Once you're done with that, then you can come back and doff. So the first thing that we do is take off our gloves. We start with the dirtiest piece of PPE first, which again is our gloves because we're using our hands to touch. So you're going to put your first dominant hand out, kind of like you're holding a pie. And you're going to take the pincher fingers of your non-dominant hand and hold on to the palm of your hand, the glove that's touching that, and you're going to pull that off, and it's kind of going to go inside out. Hold that with your non-dominant hand. Take your 2 fingers of the hand that you just took the glove off, and you're going to put them underneath the cuff of your glove, and you're going to turn that second glove inside out. Now you can immediately dispose of these gloves right in your trash can, so good thing you have it nearby. Next, I'm going to take my goggles off by only holding on to the earpieces. These can be sanitized later and reused. Next, I'm going to take my gown off. So your gown can be taken off the same way you put it on. So I'm going to turn around and show you. You're just going to untie the gown at the neck and then untie the gown at the waist until it's completely untied. And then the best thing that you can do is take your fingers and find the neck piece and put those fingers so that they're only touching the inside. We don't want to touch the outside of the gown because it's contaminated. Then you can pull out towards the outside of your body so that you're turning it inside out. And I like to roll it away from me, almost like I'm rolling a burrito. All right, so I'm rolling it away from me, and then I'm going to dispose of this in the trash can because this is a one-time use gown, but you might work at a facility that has washable gowns. So just make sure you know ahead of time, and then you can place them in the proper laundry receptacle. So I'm gonna throw this directly into my little trash can. And the last thing I'm going to do is I'm going to take my mask off by holding onto the ear loops. Okay, so your mask, it should be a one-time use, so you can throw that directly into the trash can. And then, as always, we're going to sanitize our hands. And you're going to report and record to the nurse if there is anything that was outside of the norm for your patient.